Great. We are good. All right. Hello, everybody. Welcome on Facebook. We are live. Welcome. This is Ask the Doctors. It is April, which means, of course, Testicular Cancer Awareness Month. And in just a few days, I want to say like 12 days or something, not good with math. We are going to be having our virtual testicular cancer conference. I'm BJ Lang, so excited to have you here. And if you could be so kind as to like, share, tag, get your questions ready, because this is Ask the Doctors. We're going to have a few of these here throughout the month of April. So have you been listening to It Takes Balls by Stephen Crocker, one of our TCAF survivors and board members? He's got the official TCAF podcast, and hope that you have been enjoying that. You'll get to talk to him at the conference as well. As I said, mark your calendars, 2022, the Virtual Testicular Cancer Conference, 2-evening event that's going to be happening, covering great things, great questions. Why did I get testicular cancer? COVID and the vaccines and how it relates to testis cancer, the long-term side effects and preventions of testicular cancer. So great things like that. Long-term side effects and the prevention, of course, for TC. That's very important things here that we're going to be talking about at the conference. We're going to have breakout rooms where you can talk to the doctors, and you can connect with, as I mentioned earlier, with Stephen Crocker from It Takes Balls, the host of the official TCAF podcast. We'll also have updates from our friends at the Uniball movie. Again, that's all the more reason why you should be coming to the TCAF Virtual Testicular Cancer Conference. We're going to have Q&A with testicular cancer medical experts. We'll have doctors from Penn Presbyterian Hospital and Penn Medicine, Indiana University School of Medicine that work with Dr. Einhorn closely, folks from the University of Colorado Health and Children's Hospital, Colorado, as well as UC San Diego, which leads us into our guest today. You'll also be able to meet other fellow survivors and caregivers from across the globe, as well as other countries. So make sure that you attend so that you can make great social connections. It's going to be quite awesome. We have a guest today, and I'm going to get to that here in a second. But if you're watching us, I want to make sure that you share this, tag, and get your questions. Do you have a TC question? That's what this is all about. We want to take a few minutes and speak with some of our guests who are going to also be at the conference. And maybe if you've got a question, this is a perfect opportunity. Obviously, it is Testicular Cancer Awareness Month. If you've been unable to attend our in-person conference, this is an opportunity for you to do that, since we're bringing it virtually. So I hope that you will join us. All right. As I mentioned, and I know that he is here with us, as I mentioned, we'll have some of the best experts in the testicular cancer community that will be coming to the Virtual Testicular Cancer Conference. Today's guest will be at the TCAF upcoming Virtual Testicular Cancer Conference, which takes place the 20th and the 21st of April. He'll be available during the question and answer period, where you can ask questions to the doctors. And if you have anything that you want to ask about for TC, this will be an opportunity to do that. He'll be there. Treatment, side effects, long-term care, and more. All of these things will be set up in an informal setting so that you'll feel comfortable and you'll be able to get your questions answered. Again, if you have a question right now while we're on Facebook Live, you're welcome to ask the question. Right now, do you have a question? Put that in the chat, and I'm going to have some of our team who's working on the backside here. Hello to our TCAF crew who are working here behind the scenes to get the questions here from Facebook. Our guest today is a board-certified urologist who specializes in detecting, treating, and preventing, here we go, genitourinary. Whew. I like it. My acting chops are finally coming to work. Cancer. He is experienced in surgical and non-surgical treatments for all urologic malignancies, including adrenal, upper tract, renal, bladder, prostate, penile, and testicular cancers. He has expertise in minimally invasive approaches to urologic surgery. Please welcome Aditya Bagrodia. Hey, Dr. Bagrodia, how are you, sir?
Hey, I'm doing great, BJ. Thanks so much for having me on. Really appreciate it.
Absolutely. First of all, welcome to Southern California. I'm up in LA, and I know you're down in San Diego now.
Thanks, BJ. Yeah, it's been about 6 months, blink of an eye. You know, it's certainly lovely out here. Of course, I miss my patients and my practice, but wonderful new patients to work with here in the Southern California area. And we've got to get together too soon.
Absolutely. You're a stone's throw from me. Now, you thought maybe you were going to be able to get away from us here at TCAF, but no, sir. No, we're gonna bring you back. So we got you coming to the conference here. Are you excited for the upcoming virtual testicular cancer conference?
Absolutely, BJ. I've participated a couple of times now, and it's something else. I spend a lot of time thinking about testis cancer patients, but when you get a group of patients that are survivors, sharing their stories, sharing their experiences, I think it's a unique life experience that only truly somebody that's been through it can understand, and it's touching. It's a very touching thing at the provider level, and I'm honored to be a part of it. I think it's wonderful.
Absolutely. Well, it is April. Obviously, it is Testis Cancer Awareness Month. Dr. Bagrodia, what drew you to urologic practice?
Honestly, and I think testis cancer is a perfect example for it. Knowing my personality, I wanted to engage in a discipline where people came in and they had kind of finite problems, whether that was kidney stones or whether that was cancers. And generally, patients can do very well. They come in either with testicular cancer or a kidney stone or some urologic problem, and typically you can fix it. And along the process of fixing it, you're obviously being involved in a very sensitive part of a given individual's life.
Mm-hmm.
And generally, you end up taking care of them for a significant portion of their life. So that kind of continuity of care part was extremely appealing to me.
Absolutely. And we're glad that you're doing that. And thank you again for joining us here at TCAF. Is there one thing, and we're just talking here in general. I know that there's going to be questions on Facebook, and we're gonna grab those. But just to kind of get to know you a little bit, Dr. Bagrodia, is there one thing that maybe you hear most often from your patients that you think is important to share with them right now? Maybe the most common question that you get?
Yeah. I think obviously early on in diagnosis, people are really understandably concerned about, what's the likelihood of them being cured, of them being alive. Those are, I think, 101 questions when you're newly diagnosed with the testis cancer. And as many of you all may be aware, testis cancer is highly curable, but it's also absolutely mandatory that at the provider level, we not just make sure we're curing our patients, but make sure that we're doing everything exactly perfectly, so we don't undertreat and we don't overtreat and we don't do anything that could hurt these young men, young testis cancer survivors for the rest of their lives.
Absolutely. Well, I believe we have some questions coming in on Facebook. And again, if you have a question you'd like to ask Dr. Bagrodia, go ahead and put that in the chat, and we will throw those in here to our Zoom, and I will field those for you. I do have another question for you while we field some of those questions from Facebook Live right now. When you meet a patient for the first time, how would you say to perhaps your brother, your son, hey, you should ask the doctor this question first? Are there a couple starter questions that you think are most important for someone who might be going through this for the first time?
Yeah, I think it's just being a person, and it's asking them, how are you doing with this? Most of the patients I see, BJ, are either coming in for a suspicious mass, so either they're referring urologist or referring primary care physician, said, hey, you need to go see somebody at the university because we're worried about testis cancer, or they've been newly diagnosed. And generally these are men either in their late teens or early 20s, 30s, or 40s, kind of cruising through lives in the prime of their life, and all of a sudden they get hit with a cancer diagnosis. So the first thing I always ask is, how are you doing with this? Mm-hmm. And I think that kind of just lets me know where they are, what their support system is like. Are they having any associated anxiety, depression, et cetera? Because it as many of the people may know that are listening, it's such a fast moving train. You go in to see a doctor, you get an exam, you get an ultrasound, you get markers, and then somebody's signing you up for surgery. And then all of a sudden it's like, whoa, you're at home, you're waiting for the pathology to come back, maybe wondering how your life is about to change, or you're going to be alive. So that's the first question I always ask, BJ.
That in itself is a great question. I also like that you mentioned the whole body approach, not just going to attack the cancer per se and treat that, but you mentioned depression, anxiety. The mental health piece was huge in my treatment, and something that I still struggle with, from the cancer journey. How do you tie into other folks when you go through a patient care plan? How do you tie into other departments? Are there things that you're looking for when you're thinking of a care for a patient?
Yeah, absolutely, BJ. And depending on the treatments that may be required, whether chemotherapy or surgery alone, removal of the testicle, retroperitoneal lymph node dissection, or radiation, we're learning more and more that the long-term side effects can be profound. For instance, if the testicles do two things: they make testosterone, they make sperm. And we just want to make sure that we're monitoring for signs and symptoms of low testosterone. If you require chemotherapy, we're learning more and more that there is associated anxiety, depression. There can be cognitive effects, there can be early heart disease, secondary malignancies. And actually, I'm extremely thankful to the society and the foundation for helping us distribute a survey to learn more about what is pertinent, sexual function, mental health, body image. It really is a comprehensive set of things, and any given person may be affected differently. So bottom line, to kind of directly answer your question, BJ, is we do try to engage center support services and offer that to everybody. We do make sure that we're just monitoring for signs and symptoms of low testosterone. And then I always absolutely reiterate that, we have to really have a plan, medical doctor as well for really our forth.
Okay. I think you cut out there just a little bit, but I did pick up on that. You focus on trying to get as much care as you can for that person, whole body, going after different modalities as well, the mental health piece, and of course checking labs. I know you had mentioned, making sure that hormones were good there as well. Okay, a question for you from chat. Let's see how good this came. Let's see if we can pull some here from the chat. Again, we're talking to Dr. Aditya Bagrodia, who's a urologist, focuses on testis cancers. So any urologic questions that you might have, you're welcome to put those here in the chat. And while we're on Facebook Live, you can ask, and we'll pull those from Facebook here over to Zoom, and I can ask Dr. B for you. Dr. Bagrodia will be at the upcoming virtual testicular cancer conference. You should, I highly suggest that you go check out testiscancer.org. That's our website here for the Testicular Cancer Awareness Foundation, and you can register for the conference. Okay, a question for you, Dr. Bagrodia. When there are NCCN guidelines, treatment protocols for all cancers, including testis cancer, why would mistakes be made? Don't physicians have to follow those guidelines? That's a question from Facebook. How do you respond to that, Doc?
Yeah, it's a great question. So first off, there's actually been a really nice bit of work that's been done, including from Dr. Phil Perazio, who's one of the main participants, that when guidelines are not followed, we do see worse clinical outcomes, both in terms of recurrence as well as people dying of testis cancer. So it's important. Secondly, they're guidelines, they're not laws.
Right.
And, testis cancer is rare. There's less than about 10,000 cases in the US annually. And some people are still doing what they may be doing learn during training, for instance. And our guidelines have evolved and updated. I'm quite fortunate to be on those NCCN guidelines panels. But the final bit is it's actually nuanced. The guidelines provide guidance, but there are individual considerations to any particular patient. And, we won't necessarily get into the weeds on every possible different scenario, but
right.
If you have like a small retroperitoneal mass, there's generally been a push in the field to go towards surgery to minimize the long-term side effects of chemo if it's a good, safe option. But it should be a verified good, safe option. And, other people may say, let's just give them some chemo. They should be cured, and that's that. So as I mentioned earlier, getting it perfect is the only option as I see it. But, there's nuances when interpreting the guidelines. And then, some people aren't quite as, when there's different options, people may not be selecting the absolute best one.
Right. It's a tough question. Obviously, you got to have the discussion with your providers because each situation is different. But based on these guidelines, we're taking this data and trying to apply it to the best that you can based on the situation. Dr. Bagrodia, I know we have you here for just a few more minutes, and I don't want to take up too much of your time. But a great question just came into the chat, and I know a lot of people are talking about it right now. The question is, knowing that testicular cancer is so rare, why wouldn't it be standard of care for a urologist to refer to an expert at the first diagnosis?
Yeah, that's an absolutely great question. And there has been quite a bit of literature suggesting that centralization, i.e. going to places that have high volumes of testis cancer cases that they see, multidisciplinary teams, including medical oncologists, urologists, radiation oncologists, pathologists, radiologists, directly impact care. So it is the preference. I mean, of course, at the patient level, sometimes it can be tough. If you live out in a rural community, it could be difficult to get to a physician, and
Sure.
who sees high volumes. There's that aspect of it, and then the first step generally in the diagnosis and management is removal of the testicle. And there are some nuances, including sperm banking and placement of prosthesis, and of course, the surgery should be done perfectly. But that's a pretty straightforward operation, for a urologist. So I think it's preferable, not mandatory, that the initial orchiectomy be done at a high volume center. But certainly anything beyond that, decision making should be done at places that are high volume and see a good, healthy clip of testis cancer.
Absolutely. Another question for you, Dr. Bagrodia, here on our virtual testicular cancer prep for our upcoming conference, and I hope that you'll all join us. A few more questions here on Facebook Live. A question for you, and I believe this is from Benny. Benny asked, would cannabis affect this illness or treatment?
Yeah, it's a great question. And there's always been kind of a, not causal, but a relationship between marijuana usage and testicular cancer. And suffice it to say, it's never been said that if you smoke so much marijuana or ingest it in any way, shape, or fashion that you're more or less likely to develop testis cancer. But there's always been a loose relationship. It's never been clearly demonstrated. Now, during therapy, I think there's a lot of unknowns here. There are appetite stimulant effects of cannabis. There can be anti-nausea properties associated with cannabis. And I think that this is one of those things, and particularly for patients receiving chemotherapy, this is one of those things that, it's probably worth talking to your medical oncologist, or if they have a complementary alternative medicine provider that they work with, to see if there's any role. But generally, I would say that, you don't want to smoke anything, kind of period. That can be injurious to the lungs, and some of the medications that we use, chemotherapeutics for testis cancer, can be a little rough on the lungs. So you don't want to smoke anything. Beyond that, I think the direct relationship of causing testis cancer and whether it can be beneficial, mostly from a side effect profile, is still outstanding.
All right. Thank you very much, Denise and Benny, for your questions there on Facebook Live. Dr. Bagrodia has just a few more seconds left with us. I know you've got an appointment coming up here in a minute. I don't want to keep you from that. Okay, last question. Does the COVID vaccine affect testicular cancer patients?
Yeah, let me just make sure I'm understanding the question correctly. Is it effective for patients with testicular cancer? That's how I'm understanding? Is that correct?
I'm not sure how they're asking it, Dr. Bagrodia, because it's saying, does the COVID vaccine affect testicular cancer patients? So you could probably take it either way. And by the way, I know also at the upcoming conference, we're going to be talking about this. So the person who asked this, because I can't see your name, I do hope that you come to the conference so that you could ask this again. But just in general, Dr. Bagrodia, what would you say about that question?
Yeah, the short answer is, absolutely the COVID vaccine, there's no reason to think it wouldn't be effective in patients receiving or who have had testicular cancer. In general, it would be expected to be as efficacious. The only caveat I will say is if you're actively receiving chemotherapy, that should be an individual decision made with your provider. And is it good or bad for testis cancer patients? Broadly speaking, this is not my opinion. This is backed by medical data. The the benefits of the vaccine in terms of preventing serious illness as well as death from COVID has been well substantiated, including among cancer patients in large studies that include not just testis cancer patients, but patients with any type of cancers. Mm-hmm. And I'm happy to field this one regarding the MD Anderson experience. BJ, if you want to share that question.
Yeah. And I'm glad that you saw that, Dr. Bagrodia. The question that came in here on Facebook Live, and again, thank you so much for your questions. I know Dr. B doesn't have too much time left, but the question says, hi, BJ, I'm 2 years out, 3 rounds BEP for seminoma. Looks like staging is 2C, treated at MD Anderson in Houston, had scans, blood work, and all that on February 10th. All clear and full remission, and workout 3 times a week. Still battling mental and physical fatigue. I feel you there, brother. Already on testosterone replacement. Do you have any other advice? I'm 57 years old. What would you say to him, Doc?
Yeah, I really appreciate you sharing that, because I think you'll quickly see that you're not alone. And mental health and physical health, anxiety, depression, I think that's one of those things that's just becoming okay for people to talk about openly. So I think acknowledging it first and foremost is critical. Second, it really is so multifactorial. I mean, you're 2 years out, so basically it sounds like you were initially diagnosed right at the front of the pandemic. You're going through a major cancer diagnosis, intensive chemotherapy, plus lockdown, plus or minus receiving COVID. And, where does that all kind of fall out? It's a lot for any person, and certainly for a lot for somebody that's just, battling testis cancer. So I think acknowledging it, and absolutely, there's nearly certainly an organic component to this, that is your treatment of testis cancer or anxiety associated with that. But I would seek out professional mental health with either a psychologist or a psychiatrist. And in terms of physical fatigue, the testosterone is probably one component of it, but there could be, a thyroid aspect to it, or many other anemia aspect to it. So I think it's important to be in touch. The fact that you're staying physical and exercising, and your testosterone is allegedly on the low end and replaced, I think you're absolutely on the right starting point.
Awesome. Thank you for sharing that, Dr. Bagrodia. And to all of you out there fighting, those of you out there thriving, surviving, getting through this, my thoughts are with you. And we hope that you'll join us here at the upcoming Virtual Testicular Cancer Conference. Dr. Bagrodia, thank you so much for joining us. I know that you're always so kind to take the time to come and hang out with us. You're going to be here at the conference coming up here and answering even more questions. So sorry to bore you with all of these silly questions, but it's not silly, because that's why we're here. That's why TCAF exists. And we appreciate you, Doc.
Yeah, it's my pleasure, BJ. It's a wonderful association. It's never an imposition. I truly love it. And there's no silly question. And hearing your all stories is inspiring every time. Thank you.
Thank you. Anything you want to mention to the folks out there? I know, and by the way, you mentioned earlier researchers out there, the folks who maybe you just got out of a medical school, or maybe you've been out of practice for a while, or you're on the research side. This is a good opportunity for folks to come to the Virtual Testicular Cancer Conference. If you know some of those people and you want to be more involved in what's happening, more patient-centered activities, please and come to the conference and come out there. What would you say to someone who maybe is a fresh urologist, Dr. Bagrodia? What would you say to them about coming to the conference?
Yeah, this is where you get an opportunity to hear it from firsthand, what is important to patients, to survivors. And, again, we're so thankful for the foundation helping circulate a survey, because, we don't know what the long-term effects on mental health, sexual health, a variety of other things can be. So it's a wonderful, open, collegial, warm forum. I love it. It's an excellent meeting. And I just, reiterate everything that you've had to say about it, BJ.
Awesome. Thank you, Dr. Bagrodia, for joining us. We really appreciate you again. share some love in the chat, throw some hands up and some love to Dr. Bagrodia, UC San Diego urologist. Really appreciate your time and being here. Looking forward to seeing you at the conference. It is April. The virtual testicular cancer conference is coming up here in just a few days. I hope that you'll join us. Go to testiscancer.org if you would like to register for the conference. If by chance you can't afford the $9 that we're asking for the whole household to come and be a part of this conference, whether you're a survivor, whether you're a caregiver, if you're a practitioner, whatever reason would bring you to the conference. If you can't afford that, let us know. TCAF has made the commitment to help folks so that they can attend. And by the way, that money isn't coming to TCAF. I want to be very clear. That money is going to a very awesome cause. And I want to make sure that I get it correct for the name on there. And if you go to testiscancer.org and you look at our website for the registration, which again is coming up here the 20th and the 21st, you will see that that money is going to the John Cleland Fellowship at Indiana University. So you can check out John's story and the legacy to his commitment to testicular cancer, as well as how he connects to our journey on our website. Check out testiscancer.org for that. Again, the 20th and 21st for the virtual testicular conference. Tag your friends, tag all the survivors that you know out there. If you have a caregiver, if you are a husband or a wife of a fellow fighter, a fellow survivor, tell them to come with you to the conference and you guys can enjoy it together. It's going to be great. 2 days, lots more going to be happening here on Facebook Lives here for the Testicular Cancer Awareness Month. So appreciate you being here with us. From all of us here at the TCAF, the Testicular Cancer Awareness Foundation, thank you for joining us, and we'll see you here soon. Bye-bye, everybody.